Living in a society where people are prone to initiate lawsuits means that the dental team must make their best efforts in risk management to avoid these lawsuits. These efforts include excellent patient communication, maintaining accurate and complete records, receiving informed consent, and doing everything possible to maintain the highest standards of clinical excellence. Malpractice lawsuits are best avoided by maintaining a climate of good rapport and open communication with all patients. Prevention and good communication are the best defenses against malpractice. Patients are less likely to initiate a lawsuit when they have a clear understanding of planned treatment, reasonable treatment results, potential complications, and their financial obligations. The dental assistant can play an important role in the prevention of malpractice litigation. If you follow these 10 rules of risk management, you will lay the groundwork for providing a safe legal environment for the dental practice. Number 1, when in doubt, say nothing. Number 2, if there is a problem or conflict with the patient, refer the matter to the doctor. Number 3, never say anything that implies a guarantee of unrealistic expectations of treatment that the dentist cannot achieve. Number 4, never comment on the quality of care provided by your employer or another dentist. Number 5, establish rapport, which is a harmonious relationship with your patients. Number 6, records are the dentist's best defense. Maintain accurate, complete, and legible records. Number 7, keep up to date on all of your skills. Number 8, always perform your duty or ability. It is okay to say that you do not feel comfortable providing a duty to a patient due to lack of ability. Number 9, be prepared to assist in emergencies. And number 10, do not start collection measures without the doctor's permission. A professional will never make critical remarks about treatment rendered by an employer or another dentist. The dental assistant should never discuss other patients and should avoid discussing the dentist's liability insurance. Statements made spontaneously by anyone at the time of an alleged negligent act are admissible as evidence and may be damaging to the doctor or dental assistant in a court of law. The doctrine of res gestae, or things done, refers to these actions. In this instance, one must heed the advice, silence is golden. One must never utter phrases such as, oops, or uh-oh, while working on the patient. Consent is one of the best forms of risk management. It ensures that the patient has been provided necessary information to make a rational decision. Informed consent must include information informing the patient of the nature of the condition, the proposed treatment, the risks involved, the chances of failure, the results if the condition goes untreated, and alternate procedures that might be employed. Implied consent is presumed by certain actions of the patient. Like when the patient enters the dental office and sits in the dental chair, the patient gives implied consent for a dental examination, diagnosis, and consultation. After that point, it cannot be assumed that the patient consents to further treatment. Implied consent is not a reliable form of consent in a malpractice suit. To protect a dentist from a malpractice suit, written consent is the preferred means of obtaining and documenting patient consent for treatment. There are 6 situations when consent must be in writing. These are when new drugs are being used, experimentation or clinical testing is involved, a patient's photograph is to be used, general anesthesia is being used, minor children are being treated in a public program, or treatment requires longer. A patient may not always accept the treatment proposed. The patient has the right to refuse treatment, but at this time the doctor should inform the patient of likely consequences of not performing the treatment. Now, this informed refusal from the patient does not release the dentist of the responsibility of providing the standard of care. For example, if a patient refuses radiographs at an initial examination, the doctor may refer the patient to another doctor for care because that dentist knows that he or she will not be providing the standard of care. A dentist may not legally or ethically agree to providing substandard care to a patient. Although informed consent greatly increases the dentist's chance of defense to legal allegations, it must contain 5 factors to be valid. These include that the one giving consent must be legally competent. A child is not considered competent to give consent, therefore, the parent must give consent. The consent must be informed, meaning the nature of proposed treatment, benefits and alternatives to treatment, risks and potential consequences, and other necessary information was discussed with the patient. The consent for a particular treatment or a specific series of treatment is indicated. The treatment or act consented to may be legally provided by the dentist. And consent must not have been obtained by fraud, deceit, or trickery. All of these factors must be satisfied for consent to be valid. Contributory negligence may occur due to the patient's actions or lack of action. The action can negatively affect treatment outcomes. For example, a dentist performs a molar root canal treatment and advises the patient that a crown is the next step of treatment, or he or she may likely lose the tooth. If the patient does not take action to return for the crown and the tooth fractures and needs extraction, then it is considered that the patient's lack of action contributed to the loss of the tooth. It is important to document the action of the patient in consideration of broken and canceled appointments. This documentation can protect the dentist from claims of negligent care. The patient record is a legal document that is owned by the dentist. Some state laws give patients the right to access or retrieve their records and radiographs. The patient should be given copies of their records, and the original should be maintained at the office. The patient record should never be removed from the office without the doctor's permission. It is important to be knowledgeable of what is included in the patient chart. The patient chart or record includes medical and dental histories, examination findings and treatment plans, X-rays, properly identified and dated, a detailed record of all treatment provided for that patient, any letters from or about the patient regarding treatment, copies of prescriptions, written consent or refusal of treatment, and notation of broken appointments or any failure to follow the treatment or advice of the dentist. These are not part of the patient's record. Any records that are kept for financial reasons only. Financial information such as a record of charges, payments, and the current balance. Insurance claim forms, or irrelevant materials such as postcards from the patient. Seeing as how the patient record is a legal document, guidelines for clinical record entry should be followed as a form of risk management. The quality of records reflect the quality of patient care. Ensure that entries made accurately reflect the quality of treatment. Be thorough. Make the entry as soon as possible after the patient's visit. Date the entry and sign or initial the entry. Write legibly and record in ink. and never change the chart after a problem arises. Another means of risk management is the safeguarding of patient records. This includes not allowing any unauthorized person to remove, read, copy, or otherwise tamper with any record at any time. Never leaving an open file folder on your desk when an unauthorized person could read it. Always locking file cabinets and rooms containing files at the end of the day. Refraining from answering queries regarding patients from third parties, such as a lawyer. Refer all of these inquiries to the doctor. And do not allow original patient charts to leave the practice. By following these measures in accordance to maintaining this important legal document, you can reduce the risk of a malpractice lawsuit upholding in the court of law. Dental are considered mandated reporters in most states. We are individuals who may be the first to recognize signs of abuse. Dental professionals must look for signs of physical abuse and behaviors that suggest abuse, such as being withdrawn. States that legally mandate the reporting of child, domestic, and elder abuse grant immunity from criminal and civil liability. This means that the dental professional cannot be sued for reporting suspicions in an attempt to protect the victim. About 75% of child abuse cases involve injuries to the head and neck area. Child abuse is defined as any act of omission or commission that will endanger a child's physical or emotional health and well-being. It is important that unusual or frequent injuries be documented so that pattern, if present, can be identified. Domestic violence is the battering, abuse, or control over an intimate partner within the same household. It is sometimes difficult to report as the abused individual may deny giving permission to file the report. Elder abuse is defined as physical, sexual, or emotional passive neglect, willful deprivation, and financial exploitation of a person 65 years or older. Again, this is difficult to identify as the elder may not want to protect the actions of their son or daughter who is abusing them. Dental neglect is the willful failure of a person or guardian to seek and obtain appropriate treatment for caries and oral infection. This consists of untreated rampant caries, easily detected by a layperson, chronic pain from untreated infection, injury or tear to the frenum leading to forced feedings, delay or retardation in a child's growth or development, and the child's difficulty with or inability to perform daily activities such as playing or going to school. It is important for you as a dental healthcare professional to know your responsibility in risk management. In doing so, you can support your team throughout the endeavor of providing quality patient care.